Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. Hello and welcome to the Sacred Medicine Podcast. I am your host, Margaret Romero, and last week I aired part 1 of my conversation with Dr. Ralph Esposito on enhancing your man's libido and fertility. And in this week's episode, you'll hear part 2 of that conversation. So here we go, on to the show. Having low testosterone does that equal having low sperm count necessarily?
Typically those two usually do go hand in hand. But again, to answer your first question, where do I start? I start with lifestyle. If he's 40 years old, a lot of people say, a lot of people will go to their doctor and they'll say, I feel tired. I feel low libido. I have chronic fatigue, and I have erectile dysfunction, or, I don't feel as hard as I used to be. It's kind of like the textbook answer of low testosterone, right? But I really think low testosterone is first a lifestyle issue. So I look at lifestyle. Are you sleeping enough? Are you eating well? Are you exercising? And are you getting the right nutrients? And also, what's really very much underlooked is the relationship with the partner. That is huge. I have a textbook chapter going to be published soon, hopefully within the next few months.
Nice.
Yeah, it's on sexual health. It's on male andropause, so it's actually this exact topic. And those are factors that you really need to pay attention to. Number one, interestingly, sleep deprivation is a huge factor in low testosterone. Studies have shown that men who are sleep deprived, and when I mean sleep deprivation, I mean less than 5 hours. When you get them to sleep 7 hours, it's equal. And it is equal to giving them testosterone.
If they sleep 8 hours a night.
If they get out of sleep deprivation. So if they
get out of it. Okay.
Right. So they had two group of men. They had a group of men who had low testosterone, and they were sleep deprived. And then they gave those men testosterone, right? And then they had the other group of men who were sleep deprived, low testosterone, and then just got them to sleep more. They both had equal increases in testosterone levels after that. So, how simple is that? Just sleep an extra few hours. Nobody has to, bother you with sticking a needle in your butt, every 2 weeks,
right.
Or using a gel and risking, your kids or somebody else in your family, having some, testosterone as well.
Right.
So sleep, number one. And the relationship with the partner is very important as well. And, if they don't feel connected, if they don't feel like they are working well together, that's going to impact a man's expectations. It's going to impact the way his brain works. And sometimes, they say it's all in your head. It's kind of true. And it's a little bit, simplified too much. But I think if the relationship is poor, it can really impact a male's libido and sex drive with his wife. And I've seen men with low testosterone get out of, unhealthy relationships, and their testosterone levels go back to normal.
Oh, wow.
Yeah.
I've never heard of that. Okay.
Yeah.
Makes sense.
Actually, I know one particular gentleman who had that issue. He was in his 20s. He had a poor relationship with his partner, and afterwards his levels went back to normal. Obviously, we worked on other things as well, but that's definitely a factor. Other things to consider. You really need to do so. My perspective is precise, personalized, and progressive. So I want to be as precise as I can get. I want to make it specifically and personalized for you, and then I want to think ahead. Where are we going with this? And lab tests are really important. So I want to look at the labs. I want to look at testosterone. I want to look at free testosterone, sex hormone binding globulin, DHEA, DHEAS, estrogens. If I can get, the estrogen breakdown, so the 2 series versus 16 series, I want to get as much information as I can get, so I kind of know where the issue is lying. And that's what I mean when I say, getting to the underlying cause. So those are the few of the places that I start with. And then there was a second part to your question, which I kind of got off track on.
Same man comes to you with low testosterone, but him and his fiance are looking to, or wife is starting to have a baby within the next 6 to 12 months.
Right.
And he's got low testosterone. Normally, if that's linked to low libido, is it also linked to low sperm count and low sperm motility?
Yeah. So usually, again, those two things, they tend to go hand in hand. And right. So I remember where I was going with this. There are men. So there's also men, and this is why a lot of times androgel and all these other testosterone enhancing pharmaceuticals, gels and injections and patches and the pills and things like that. Sometimes men, their testosterone levels will increase, but they don't show, their sperm counts may still be suboptimal. Their testosterone, they may still feel a low libido. They may still feel have erectile dysfunction, and that's because your testosterone levels can be normal, but if the androgen receptors or the testosterone receptors are not functioning properly, then what will end up happening is you're not really going to have a great response. So there are many men, and this is why there's a lot of controversy with testosterone replacement, because in order to be considered or to be diagnosed with low testosterone or whatever you want to call it, andropause, late onset hypogonadism, or just hypogonadism, you need to have the symptoms of low testosterone, and also you need to have the labs to show low testosterone levels. So there are men who have low testosterone and they have no symptoms, and then there are men who have symptoms, low sperm count, low libido, and their testosterone levels are normal. So why is that? If their testosterone levels are normal, then they shouldn't show any of the symptoms.
Right.
Right. And if their testosterone levels are low, then they should show symptoms. And that's not always how it works.
Okay.
Because it's the androgen receptors that actually can be functioning poorly. And that's where we go into the aspect of stress. And if stress is an issue, then it's going to impact the way these receptors work. So usually if a man comes in and he does have low testosterone and they are looking to expect a child, I would look to increase his testosterone levels. There's no real downside to having normal testosterone levels. It will help with fertility. So usually men with low testosterone will have abnormal, sperm motility and velocity and sperm count, and they might have more agglutination. They certainly will have less semen volume, because testosterone is involved with making, and that's one thing that we notice. You can ask a man, it's like, do you notice when you ejaculate, is it less in volume? And if they say yes, you could be like, well, that's a sign that there might be low testosterone. And if the sperm aren't given the right nutrients in the ejaculate, which is partly due to testosterone, then they may have issues with fertility. So I start with increasing their testosterone levels and making sure that it's in the normal range, and then the free testosterone is in the normal range. And that's just a good way to start. There's no downside. It does not promote heart disease. There's a lot of studies showing it does not promote prostate cancer. Actually, contrary to what we know, what we believe, and what most people are taught in school, is that testosterone causes prostate cancer. No. If you have prostate cancer, giving testosterone will be a problem, but having optimal testosterone levels is actually protective against prostate cancer and heart disease and Alzheimer's and cognitive decline. It's important. So yeah, I do work at making their testosterone levels normal. And
you're doing that with the things that you mentioned earlier, with ashwagandha and the maca and the zinc, or
ashwagandha. Yep.
Are you actually giving them testosterone injectable?
That would be a last option for me.
Okay. Yeah.
I wouldn't go that as my first option.
From what I know, giving a man injectable testosterone, whether it's 100 milligrams or 200 milligrams, can potentially actually decrease fertility.
That's exactly what it does. Actually, which brings me into one of the other blogs that I wrote about is male contraception. Did you get to take a look at that study?
I did, and I wanted to ask you about that because that
Yeah,
sounds really interesting. Since women have been the ones, well, aside from obviously men using the condoms, women have been the ones that have needed to, insert the IUD, birth
right,
control pills.
right, right. So now us men, now we need to take more responsibility.
Yeah. So
And
what's out there now?
so there's two things. Oh, right now I believe there's only two options for male infertility or for male contraception is vasectomy and condoms. As of I know right now, there's nothing on the market that is legally considered a male contraceptive. In the past month or so, there have been two options to promote a male contraceptive. There's one which is a hormonal aspect, which is male contraceptive shots. And what they do is they give men supraphysiologic levels, so very, very high levels of testosterone and progesterone. So
Okay.
as we were talking earlier, when you give a man testosterone, in the end, it actually might shut down their
Yes.
testosterone production when they stop. That's why we give the HCG and the Clomid to kind of boost the system and say, hey, knock on the door, wake up, right?
Right.
Well, now, what they're doing is they're giving men. Well, actually, no, they're not doing this because the study was shut down because it was unsafe. But what they did was that they gave men testosterone and progesterone shots, and what that would do is it would reduce their testicles would stop producing their own testosterone, and in that aspect, it also stopped them from producing mobile and functional sperm. So their semen would be it would have lower sperm count and actually almost none. And they found that it actually was 95% effective in the participants.
Wow.
Very, very effective, but it was not safe. These men had depression, they had mood disorders, they were getting acne,
Oh,
and
wow.
yeah, and one thing that would happen is they were having increased libido. I don't know if I would call that a side effect. I think that's kind of it's a main effect of testosterone. But they had to give them progesterone. And yes, to your listeners who are a little bit confused, like why would they give a male progesterone, which is typically considered a female hormone,
Right.
is because when you gave them so much testosterone, it actually can be so damaging to them that it would damage their whole endocrine system. So they had to give them progesterone because progesterone also can turn off the hypothalamic feedback system. So they gave them progesterone and they don't have to give them as much testosterone.
Now,
So go ahead.
but testosterone can convert into estrogen.
Yes.
And so maybe the progesterone is there to balance out the estrogen because you don't really want the man's estrogen to go above a certain level.
Exactly.
Do you think that the progesterone is to balance increasing levels of estrogen, which is more, what was the dosage on this testosterone that they were giving?
Oh, you know what? I don't know what the dosage was. I could definitely look that up for you and we could share that with your listeners later on.
Okay.
I don't know the exact dose. I know it was a very high dose. I really wish I should know that, but I don't. And the reason why they were giving the progesterone, according to the study, was so that they didn't have to give as high levels of testosterone. But yes, you're absolutely right. The progesterone can be there to help balance out the estrogen levels. And the estrogen will be converted. It will be made when, from aromatase from the testosterone. So yeah, that's a little bit dangerous too. And high estrogen levels is a risk factor for prostate cancer. So
Right.
I'm not comfortable with that. So that's one thing that's out of the
Okay.
loop now. And then the other option was something called Vasogel, which is it's kind of like the reversible. Oh, and I want to mention that this study that they did with the shots of testosterone, after they stopped, it was reversible. So the men became fertile again within a month or 3 months.
Oh, okay.
But I wouldn't take that chance because I've seen so many men take testosterone, just for aesthetic reasons, and then they have issues down the line, with thyroid issues. I've had one patient have Hashimoto's, which I don't know the connection there, but he was on testosterone. 3 months later, stopped the testosterone and then developed Hashimoto's. So I'm a little bit cautious when, doing that.
Definitely.
And the other option is something called Vasogel. It's actually, what they do is they inject a gel, preventing sperm from, so it's it's a reversible gel. So they inject gel into the, I believe it's the epididymis or the vas deferens. And what it does, it kind of acts like a filter. So when men ejaculate, no sperm pass through. But they have not done studies on men. It's only been on rabbits.
Oh, yes. Okay.
No hormones involved. It's pretty safe. But no human trials yet. And it's reversible. So, 5-10 years down the line, all they do is they inject this solution to basically break down the vasogel, this gel, and they can have kids again, which is, vasectomies are reversible, but it can create problems. So this is kind of a good option for younger men who may not want to have a vasectomy but want contraception, and it's safe.
All right.
Yeah.
Let's see. What else did I want to know about this? We talked about the HCG, which I was curious about, the contraception, fertility, and then is there anything else? I know we were talking about ashwagandha, maca, and zinc, in foods, decreasing stressors to help with infertility. All of these will also increase libido as well, equally?
Yes. Yeah, they should. Ashwagandha, maca is kind of like my go-to. Maca works really well for increasing libido. There's a lot of other herbs as well. Although some of them are a little less studied in humans, more so in animals, but the results are phenomenal in animals. And I've actually seen a lot of anecdotally good results. One of them is Damiana. Have you heard of Damiana?
No.
It's an herb that's actually been used. Its species is called Aphrodisiaca, which yeah, I mean, right. So we go back to this whole hey, what does it sound like? What does it do? Right. And so Damiana is a great herb that can be used for that. Yohimbe, I'm sure you've heard of Yohimbe.
Yeah.
That's actually very good. A lot of studies, a lot of people say, oh, Yohimbe doesn't work and it's dangerous because it can increase, your heart rate. That is true. But actually what you can do is, if you combined, arginine, so about 6 grams of arginine with Yohimbe, you don't even have to use a lot of Yohimbe. It actually has been shown to treat erectile dysfunction.
Oh, wow. Okay.
Yeah, using those together. Yohimbe alone, I've seen it help, but with the arginine, it's a phenomenal product. And then there's other things to increase libido as well. Have you heard of, I'm sure some of your listeners have heard, even some of your male listeners, they've been to the gas station and they've seen horny goat weed capsules.
Yeah.
Yeah. Epimedium. It's a Chinese herb. Actually acts like a PDE5 inhibitor, very similar to Viagra and Cialis. But again, not a lot of human trials on it, and the doses have to be a little bit higher. But I've seen that work well for erectile issues. Not so much for libido, but the libido aspect, I definitely go with zinc. I go with maca, ashwagandha. Damiana is a great herb. Some of them I like. Another herb is mucuna. Are you familiar with mucuna or dopamine?
No, I haven't. I don't think I've heard of that.
That's another one. Actually used for a lot of Parkinson's patients, because it has L-dopa in it.
Oh, nice.
And dopamine, what it can do is it can help lower prolactin. So if you have men who have high prolactin levels, prolactin will inhibit FSH and LH, so it'll prevent testosterone production and fertility. So what do you do for that? Well, number one, you have to get an MRI to make sure that they don't have a prolactinoma or something in their brain that's causing the prolactin. But then you could also give them mucuna, which traditionally has been used for infertility and as a testosterone enhancer, and that can actually be very helpful. One of my favorite though to use, and I've seen great results with it, is DHEA. Have you used that?
I have.
Yeah, I think that's a great supplement to use, but I really want to make sure that their levels are normal. I want to make sure where their levels are, because I just don't want to give somebody hormones if they don't need it.
What's the level that men typically need to be at?
In terms of DHEA levels or the dose?
No, both. And do you test DHEA or with the sulfate? There's two different types of. Which one do you?
Right. So I usually go with the sulfated form because it's a longer lasting.
Yeah,
A longer lasting form.
I do too.
Yeah, and it's much more reliable because the DHEA levels, those can change. So I usually do the DHEAS. I can't recall the numbers offhand because each lab has been using different markers. I for some reason I want to say between 200. I think the marker the normal level is between 200 and, or maybe I think it's 200 to 400. So I like to see it in the mid range of that. I don't like to see it very low. And usually in older men, if it's below 200, I definitely want to make sure it's at least 200 in terms of the blood levels.
Yeah.
And now if I were giving it, it really depends on their levels. I start low and then I go up. But again, you have to address the adrenal dysfunction. Why aren't their adrenal glands making this DHEA? And that's where I really start. But I've seen men start at 15 all the way to 50. I've even seen some people go up to 100.
Yeah.
Yeah. So that's a really effective supplement. Actually, haven't seen any side effects from it, and it doesn't really impact the feedback system. So, long-term use of DHEA, I've never seen that, or I've never seen any research, nor have I seen it clinically, cause the same side effects as testosterone as in terms of fertility and things like that. It won't cause your hypothalamus or your testicles to shut down. So I really like that as a therapeutic.
Though I wanted to mention two things that you mentioned before. So when you do give, I'm not sure if you see it with HCG, but I know you see it when you give testosterone replacement, that your testicles shrink, right?
Yes. Yeah.
Very, very small. A lot of men don't like that.
No, they don't. Yeah, I never even asked a woman what they thought about it. I don't even know if they notice.
I'm sure we'd notice.
I would imagine so. I would imagine from a male perspective, I wouldn't know, but I could definitely see women noticing that as well.
I mean, do the men come and complain about that?
They definitely notice. I wouldn't call it a complaint because they kind of know that it's going to happen.
Okay.
They already know. It's like, yeah, well, Mr. John, your testicles are going to shrink. But yeah, I definitely would say they kind of feel like it's impacting them. So I would kind of call it a complaint. I haven't heard their partners talk much about it.
Okay. Interesting.
Maybe they don't want to make their man feel a little less manly by, saying, hey, your balls are a little bit smaller.
Do you know, can I just tell you something though, that I feel like women tend to really not focus their energy in the balls. Yeah. I don't know. It always amazed me how the women, some of my friends are like, no, I don't do anything with them. And I'm like, really? Why are you leaving them out? There's sort of a vital part of all of it. I think a lot of women just really don't know what to do with it or how to massage them or
right. For some men, they love it. For some men, they enjoy it. And then for some men, it might be a turnoff. I don't know. Maybe their experience with some men. But it's definitely part of the area. You need to pay attention to it. And it can be a turn on for some men. Lower testosterone.
Yeah. Sorry, go ahead.
No, giving a man testosterone and then the testicles shrinking. I haven't heard about that impacting the sex life, but I can't imagine it not being a topic of conversation, perhaps.
Well, what I'm wondering is that if it does shrink, they're still having sensation. So it's like you still don't want to ignore them, whatever size they are. big, small, or not. I think that they should be. They really need to be part of the whole. They are the part of the package. So, but I know a lot of women really.
Figuratively and literally.
Yeah, exactly.
Yeah.
So, I wish that women could focus a little more of their energy and like learn how to massage them and how to play with them and how to stroke them sensually in order to help. I don't think I've ever met a man that has not liked that.
Right. Right. And you know, some women might feel uncomfortable. But again, that goes back to the big thing is the relationship. How is the relationship there? Do they feel comfortable with each other? Do they feel comfortable talking about it? Those things need to be brought up. And if a
Right.
woman is not, you know, I mean, it goes same thing for a woman. Some men ignore women's breasts, right? It's like they're just focused on the pelvis area, and that's what they look at. And then some women are like, hey, you know, there's two parts to me here too, you know. So that some men are just not, they may not be comfortable, they may not know what to do. Maybe in the past they had an experience where you know, their partner didn't like it. I don't know. I can't tell you exactly why.
Well, I think maybe part of it is that let's just say a man has been with a woman, been with several women, and none of these women really did much down there with the balls.
Right.
So the guy doesn't really know, like, oh, can you try this? Because I know that feels really good because he may have never experienced it.
Right.
And I mean, I have even a couple of, I mean, not that many, but I have a couple of girlfriends that are like really adverse to even like blowjobs and things like that. So they're definitely not doing any ball play whatsoever.
Right.
But the ones that are, I just, you know, or if you're not and you're listening to us right now, I think you should start and get some like massage oil, and of course you're going to be really gentle with your approach always.
Right.
And even if you're down, you know, down there, you know, just, you know, even licking around, I think that's a very, very sensual, and I think that feels really good for the man. And experiment, because obviously every man is different and what he likes, doesn't like, but certainly be open to it and kind of explore together. I think it's really cool.
Right. You know, the word that is, I can't think of it, but I believe it's an Indian form of sexual. I don't want to call it sexual therapy, but it's of a sexual connection that I can't think of.
Kama
the name.
Sutra?
Yeah, no, not Kama Sutra.
Oh,
it's kind of
Tantra.
like, yes, that's exactly it.
Okay.
And that a lot of people don't realize how powerful that can be, is actually being in touch with or being connected to your partner. And that might just be, you know, you don't have to just go ahead and target that area. You don't really just need to go, okay, you know, Margaret told me to go, you know, pay attention to his balls, so I'm going to go ahead and no. You want to make sure that it's in the right way and that you're both comfortable with it. But that can be a way of you guys, you know, getting more comfortable with each other, and that really has a big impact on the sexual relationship and impacts the relationship as a whole. Because
Definitely.
it's important to do, and that's been something that's been around for centuries, you know, in Ayurvedic medicine, but also in India, but also in Chinese medicine. The dantian. Are you familiar with that?
I know the word.
So it's
Yes.
basically the area below the umbilicus and like in the pelvic area.
Okay.
And there's this traditional use. It's called the iron crotch, which has been probably translated and botched. But really, what it is in order for men to increase blood flow and energy flow to their pelvic area, they take their palm, or they take their palms together and they rub them together until they get warm. And then they pretend they have like a dot in the middle of their palm. And then they take a point right below their belly button and they just rub clockwise 81 times. And then they rub their hands together again and they rub 81 times counterclockwise. while with the other hand, so the hand that's rubbing, the other hand would be on the genitals. Um, and that actually is, I've seen some studies on it or some articles on it on increasing blood flow and vitality to the pelvic region, to the testicles and the genital area. And I mean, I haven't heard any people saying that it was harmful. So that can be a good way to increase energy to the lower to the dantian, to the lower jiao, as we would say in TCM, the lower burner. And actually, where you're rubbing is Ren 6 and Ren 4 for those who are into Chinese medicine, and those are traditional points used for infertility and erectile dysfunction and sexual dysfunction. So, might be worth a try.
Now, can you do this with a partner, or do you have to do it by yourself?
I know of it being used by yourself. I can't see why you can't do it with a partner, but I would first try it by yourself. And that would just get you to be more comfortable and aware of your body. And then perhaps introduce a partner, later on. But I would first try it by yourself because, again, these exercises, you can do them. I mean, not even just for sexual health, but you could do it for some people who just feel like maybe like bladder issues, like interstitial cystitis, or people who have like endometriosis, and it could actually allow the energy flow there to be improved. I mean, even for women, you could just take it, you rub your hands together, and with one hand you just hold it on your belly, and the other hand you just do circular motions like below your belly button, and that can actually get energy flow to that area. I haven't seen it used for women, but that specific protocol. But doing qigong and tai chi, it's definitely part of some protocols there. So I can't see why not.
As you're telling me this, it kind of, I feel like, are you familiar with the chakras?
Yeah, exactly.
Yeah.
Yes.
And that how it's just, and chakras there are 7 energy centers of the body stemming from chakra 1 through 7. There technically are other ones as well. I think there's 12, but the main 7 start down in the pelvic area, and then
exactly
belly button, heart, throat, third eye, and then above the head. Right. And they are sort of energy centers. So when the chakra energy is blocked, it can show up as some kind of chronic illness or disease or something like that. So you want to make sure that the chakras remain open.
Yeah.
And so this sounds like a great way of manually doing that.
Right.
Yeah.
Yeah. It's like, and then, a lot of people do belly breathing.
Right.
It's kind of just focusing the energy there.
Right.
It can be a good first step. And then, acupuncture does that with using needles. And for some people who don't feel comfortable doing that, or may not, it may not be helpful for them, acupuncture is a great way to get energy flow in that area. I've seen acupuncture work phenomenally well for erectile dysfunction, for prostate pain, for pelvic pain. Man, I mean, sometimes people, I just say, it's going to help. It's such a powerful medicine, and acupuncture is really great for that.
Well, I know a lot of women who go to get acupuncture when they are in the process of doing in vitro, right, and all of that to boost up their fertility.
Oh, yes. I mean, if any woman, to any of your listeners, or I would say if you're going to have in vitro, you really should be getting acupuncture as well. It just increases its efficacy, and it doesn't hurt at all.
Yes, absolutely.
I think that's something that should be standard of care, but I'm a little bit biased, but I think it's great even if you're not looking to get pregnant, acupuncture is great for vitality and making sure the body's working how it should.
Yes, absolutely.
Yeah.
All right. Well, what an awesome interview. Is there any last pointers or anything that we missed that you wanted to leave our listeners with?
We covered so much. I think we did a great job. I think your listeners are going to be really, really happy. especially if not
Yeah.
for, the female listeners, they're going to be happy for their husband. And the male listeners, they're going to be happy how they can help their wives, or be better, partners for their wives. And even just not the sexual part of it, but just having a healthy, healthy lifestyle. Um, when you are living a good life, your whole body can benefit from that. Not just, I know I'm a men's health expert and I specialize in integrative urology, but you can't just focus on, the pelvis or the kidneys or the bladder. It's really the whole body,
Exactly.
and that's what we really need to pay attention to. The brain. That's why, I mentioned before, you really have to identify the underlying cause. And I think your listeners are so lucky to have you expose and bring more attention to these areas, because a lot of people don't want to talk about it, but it's there, and the research is there, and top researchers are talking about it too, and it takes people like us to expose it and give it to your listeners. They're lucky people.
Yes, thank you.
Yeah.
So
it's been a pleasure.
What's that?
I said it's been a pleasure.
Oh, yes. Same for me. I have 3 really short, quick questions
Sure.
that I ask my interviewees. What is your biggest indulgence that you love, whether that's a food or...
Does it have to be good or bad?
Either one.
Oh,
Could be
man.
bad. Tell me what the bad one is.
It's not bad, but it's not great. It's wine.
Okay.
I'm a big wine fan. Actually, being Italian, we make our own wine.
Oh, nice.
So I enjoy a glass of wine every so often. I wouldn't call it technically bad, but it is alcohol, so it has its downsides as well. That would probably be it. And I love just having pizza. It's the Italian in me. I have to have it. I have to. Yeah, that's my indulgence, I guess you could say.
What is currently at your bedside?
Right now, my stethoscope and a pumpkin spice candle.
Okay.
Yeah.
Nice. I thought for sure you were going to say, I don't know, lube or...
Not quite. Those are hidden.
You don't have to be PG here or G-rated.
Gotcha. No, I'm looking at my bedside right now, and I'm like, okay, my stethoscope is there, and so is my candle. Yeah.
Okay, good.
Yeah.
And since you're our first male listener, and since this is kind of on the topic of what we were discussing before, what do you wear to bed?
Oh, boy. A lot of the times I'm just wearing very loose boxer briefs. That's it. So in the summer, I try not to, but I live with other people, so I don't want to be too exposed. But I do wear very loose fitted boxer briefs. I let the boys breathe.
Okay, good. You practice what you preach.
I certainly do. And in the summer, I will tell you, I mean, a lot of the times I won't, if it's really hot out, I don't really like the air conditioner. And I'll just be like, you know what, I'll have a very light blanket and I just let the boys breathe. But most of the time, very loose fitted boxer briefs, cotton boxer briefs.
Okay.
Got to be comfortable.
Absolutely.
Yeah, it's a different answer than probably a lot of your other guests have said. I mean, I don't wear sexy lingerie or...
Actually, no, this is the first time I've asked that question.
Oh, okay. Great.
Because we were talking about it. I was like, oh, let me see.
I do practice what I preach. I really think that's important. You have to let the boys breathe. For women too, but also for men.
Oh yeah, I'm a nudist at heart, so.
Yeah. Living with other people is a little bit more difficult to do that. But I'd rather not lock my door. But yeah, I get it.
Yeah, totally.
I get it. Awesome.
All right. Well, thank you so much. Oh, and where can people find you? I keep forgetting to ask.
Oh, okay. Well, you can. I'm a practitioner in Westchester, so I practice at Armonk Integrative Medicine in Armonk, New York. So there I do functional medicine, acupuncture. One thing that we didn't talk about is nutrigenomics. So I do a lot of genetic analysis using like 23andMe data.
Oh, yeah.
Which is also very important for fertility and sexual health and hormone levels. And then if you want to contact me, you can email me at ralph@drespo.com. My website is doctor, spelled out, doctorespo.com. Yeah, a lot of people growing up, they call me Espo. My last name is Esposito. So I figure might as well just go with the neighborhood name.
And I found you on Instagram. So you're on Instagram.
Oh, yes. Dr.espo. If you want to find me on Instagram, I post everything related to men's health, sexual health. I'm a foodie. I love food. So you'll find stuff there. And yeah, please feel free to contact me. I always love helping people. I actually was on my way home from the city today. I Snapchatted one of my best friends. I said, I just love what I do. I just genuinely love it.
That's so great. It's such a good feeling, isn't it?
It's the best feeling in the world, especially when it's a nice sunny day and it's November 18th and it's 60 degrees in New York and it's sunny. It's the best feeling in the world.
Mm-hmm.
I generally love what I do. I love helping people. I love, showing them, I love seeing them get better. And it's nothing better when you see somebody come to you and they couldn't have children or they, had issues with their hormones or they just couldn't sleep or anything like that. I just love to make them feel better. So, yeah.
That's awesome.
Yeah. You don't have to come visit me. You could call me, email me. I'm happy to help anybody.
And follow him on Instagram. You'll get a little sneak peek into his life.
Yeah, that'd be fun. Yeah, you follow me. I follow you on Instagram too. You see a few things that I post.
I do. I see everything usually that you post.
Yeah, I try to make it entertaining as much as I can and informative too. I practice what I preach. I promise. As we should.
Yes, and we'll have to talk about that spa castle. We'll have to talk about that.
Yes, I wanna hear about that. You have to hear about it.
Definitely. All right. Well, it was a pleasure to interview you today. I learned so much. And thank you for all of the knowledge that you're bringing to my listeners about infertility, boosting infertility, libido. Loved it all. Loved it. Loved every second.
Thank you. I'm honored.
It's been a pleasure. Have a beautiful weekend.
Thank you so much for listening. I really hope you enjoyed boosting your man's libido and fertility. To learn more about Dr. Ralph Esposito and for all the show notes, go to margaretromero.com/episode 10. And just in case you missed part 1, you'll find all the show notes and information there as well at margaretromero.com/episode 9. Definitely listen in on that because we go over all the foods you need to be feeding your man to boost his libido and fertility. Hope you have a beautiful week, and we will see you next week.